Here we are at the back care clinic today. I have a patient here who has tenosynovitis of the abductor pollicis longus, which is overuse, which has caused arthritis into the actual joint capsule of the thumb. So what we're doing today is an injection to take the pain away and stop any arthritis in its tracks and give pain relief. The subject is a teacher who uses their thumb quite a lot for writing and blackboard work. You can see she's had a few injections in the past which have now caused a little bit of scarring, but what we're going to do today, we're going to do an injection. I'll show you two injections actually at one time. This is the thumb tendon, or it's called de Quervain's tenosynovitis. This is overuse of abductor pollicis longus and extensor pollicis brevis. And you get pain over the thumb joint itself, and sometimes occasional crepitus, which is like a crunching. Now, also we're going to give an injection into, while we're there, we may as well do into the actual thumb joint itself, as there's degenerative arthritis in there, in the actual joint itself. So you get painful and limited passive adduction and thumb of the thumb pushing backwards and behind. So you get limited passive extension and adduction as well, abduction as well. So hopefully today this is going to get the patient out of trouble, and they normally last between 6, sometimes 12 months. I think eventually this lady will need a saddle joint replacement here, but we can keep her out of trouble, I think, for the next couple of years, and keep her out of pain, which you'll be quite happy with, won't you? Okay, so I've prepared our injection. It's going to be 20 mils into the actual thumb joint and 20 mils actually into the tendon itself. I'll hand the camera over to Yordi. Okay. Okay, so what we're going to do first of all, we're going to go into the thumb joint itself. So I'm just going to do a little bit of traction, and we're just going to go in. It's a little bit uncomfortable. That was really good. We're right into where it should be. Now I'm going to pull out to make sure we're not into an artery or a vein, and we're just going to put a few mils in there. Just let that numb off a little bit, and just go in a little bit more. Now we're going to turn round and come up the tendon there. Again, we're going to pull out to make sure there's no blood, and then we're going to go into the tendon and finish off. There you go, and that's it. It's all over and done with. How was that?
Okay, yeah.
Good, no pain at all. We always numb the skin off and put a numbing pad on afterwards to make sure that everything's nice and numb before we actually put the injection in, and we also use an anaesthetic into the actual joint itself. And that is arthritis of the thumb joint. And how's that feel? Wiggle the thumb around. Has that lessened the pain?
Yeah, it has, yeah.
Okay, lovely.